Hi, I'm Dr. Tash. Today I'll be talking about curcumin or turmeric and its possible anti-inflammatory role in arthritis and even endometriosis. The inspiration for today's video has come from Alison. Alison wrote me a message. She writes, "Hi Tash, I thought you might find this interesting. I have recently started taking curcumin for my knee a few weeks ago. Last week my period arrived and guess what? No period pain at all. I have always had horrible period pain. I normally take Ponstan and Panadeine. I am stunned. I have never had a pain-free period. It will be interesting to see how I go next month. Just thought you might find it interesting." Alison also said that she'd been taking it for about 3 or 4 weeks before her period arrived. She said, "I also didn't get that horrible bloated feeling." So Alison took the curcumin supplements for her knee and she found that the knee pain dramatically improved. Coincidentally, she found that her period pain improved too. Now that's not unusual. Patients often find this scenario when they take it for one reason and they feel that something else has improved as well. This is a perfect example of how curcumin can actually have anti-inflammatory benefits throughout the body. So what is curcumin? Curcumin is the active phytochemical in turmeric. Here I've got the turmeric root, I've got turmeric powder, and I've got curcumin as a supplement. Curcumin is a spice that is indigenous to South Asia. It's been used for a very long time as part of Ayurvedic medicine, which is the traditional Indian medicine, and also Chinese medicine. But more recently, scientists in the Western world have become a lot more interested in this spice and are doing more research in this area. Turmeric is now available as a supplement. Research has focused on turmeric's diverse pharmacological properties, which are antioxidant, anti-inflammatory, anti-cancer, and antibacterial, in addition to its use in cardiovascular and gut disorders. Curcumin may help calm an overactive immune system and hence dampen inflammation, which is why, Alison, you felt your knee pain significantly improved and why your period pain was also a lot less painful than usual. Now I'd like to talk about a paper about endometriosis and curcumin. In 2009, in an Indian journal of biochemistry, there was an article published that looked at curcumin and how it may shrink endometriotic deposits. They looked at mice and they induced endometriosis in these mice. And what they found is when these mice were given curcumin, the endometriotic deposits or lesions regressed. Now, you might say, wait a minute, these studies were done in mice, they weren't done in humans. And what you'll find in nutritional medicine is that doing studies in humans when it comes to food is actually quite complex because there are so many other things that are involved in nutrition and digestion and use of nutrients, etc. What you might find interesting though is one statistic. On average, the protein coding regions of the mouse genome are 85% identical to the human genome. So we're a lot more closely linked to mice than we may previously have thought. So it might be difficult to extrapolate the dose of curcumin used in the mice to humans. And it's true, it is difficult to extrapolate that. And that's why it's important to continue doing the studies. In human studies, it's quite safe to use high doses of turmeric, up to 8 grams per day. Now, it's best to avoid high-dose turmeric if you have certain issues like gallbladder, for example, gallbladder issues. If you've got cancer, it's really important that you don't take any supplements before consulting with your doctor. And other situations in which you may be cautious in how much supplements you do take of curcumin, pre-pregnancy or pregnancy, because the turmeric or the curcumin can be actually quite stimulatory to the uterus. The other scenario in which you should try and avoid taking curcumin supplements is pre-surgery, because curcumin can actually thin the blood and cause excessive bleeding. So that's an absolute no-no. I'd love to share a recipe with you. It's on my website, www.drandriadis.com.au. This recipe was given to me by one of my patients. She swears that when she has this shake daily, it stops her hair from falling out. And I wonder, is it the turmeric? Thank you for watching Dr. Tash TV today. If you've enjoyed this episode, please share it with your friends. Please subscribe to my YouTube channel so you don't miss out on any goodies in the future. And until the next episode, stay well and I'll see you soon.